But thank you to the Greater Miami Chamber. Jose, thank you. Al, thank you again for holding this interactive roundtable to discuss the plans for reopening of South Florida. I know that we're all looking forward to moving to a new normal and so that people can get back to work. I know I certainly am. In Miami-Dade County, we took the first major step toward that goal yesterday. And we opened up the outdoor spaces, including our parks and our waterways and golf courses. This is a way to show the residents of Miami-Dade that there is a light at the end of this tunnel. I went out and checked on various locations, and I was pleased to see that people, our residents, are basically following the rules. We have invested heavily in making sure that there is enforcement in these outdoor spaces so that we can continue to tamp down on this virus, and enforcement is the key. The physical and mental health of our 2.8 million residents is my top priority as we confront this virus. Medical experts agree that people need fresh air, they need sunshine and exercise to really, thrive in these challenging times. And so we decided to open these outdoor spaces after consulting extensively with our health experts at the State Health Department, Jackson Health System, UHealth, and the medical schools at FIU and They had complete buy-in into the program and the process that we initiated that led to opening of these parks and marinas and golf courses yesterday. They helped us set the health and safety parameters for opening up those spaces, including the use of facial coverings, strict social distancing, and frequent deep cleaning of high contact surfaces. We also worked extensively with our coastal communities, the League of Cities, officials in Broward, Monroe, and Palm Beach counties to make sure that we have coordinated approach to reopening that is clearly understood and communicated throughout the region. It wasn't luck, it wasn't coincidence that Broward and Palm Beach announced the same measures, basically the same measures at the same time. Now, I want to stress that my executive orders for the county set the minimum standards. That means we allowed cities to open their parks, but municipalities may decide to not open city parks or only open some of them. Some cities may not have sufficient enforcement personnel, and I said that's really critical, and the enforcement personnel on hand to assure that the rules are met. This can add to some confusion for residents, but overall, many, if not most, of Miami-Dade County cities have open parks, golf courses, and other public spaces using our guidelines. And like I said before, part of the process is the Miami-Dade County League of Cities and also the Managers Association. They're completely entrenched in our process. So it's important to get the right information before you plan to head outdoors to a park, marina, and golf course. Make sure they're open and check out miamidade.gov new normal for all the details. Now we're expanding our scope from outdoor spaces to begin strategizing ways that we can move and start moving towards opening interior spaces, including non-essential businesses and cultural venues. The open space working group that included our medical experts helped us kind of to develop a framework that we're using right now as we move forward to the interior space initiative. By having healthcare experts team up with business professionals, we ensure that each group brings a balanced perspective. And what I mean by that is it makes no sense for non-medical personnel or only medical personnel to be inside the group because we may come up with regulations that actually is unworkable for the business community. And so we have to have a balanced approach to this, something that'll work for the business community while at the same time making sure that we keep our community safe. Public health is at the center of this initiative, and as we develop specific plans on how businesses can reopen. The county's interior spaces working group covers restaurants, museums, and cultural venues, small businesses, retail shops, factories, malls, office buildings, trade and logistics, hotels, and everybody's favorite, personal grooming businesses. That's the number one complaint that I get. Yesterday, Governor DeSantis announced plans to open up many businesses in the rest of the state based on the number of COVID-19 cases that they're experiencing. The exception to that order is South Florida, where Miami-Dade, Broward, and Palm Beach counties are working together to contain the virus and develop plans. The good news is that we're flattening the curve here in South Florida. The number of hospitalizations has been steady for more than 2 weeks, and this is helping us move to this first phase of openings. As a member of the governor's Reopen Florida Task Force, I can tell you that we have been working hard to open up in smart ways that take into account medical experts' advice every step of the way. I want to thank the governor for his leadership and flexibility as we continue moving to a new normal. In Miami-Dade County, our working groups are data-driven. epidemiologists and infectious disease expert, as well as the Florida Department of Health, are part of each one of those groups that have also industry experts for that particular business. The county is also hiring a consultant to track all the public health indicators from testing availability to hospitalizations. And by the way, we have some of the best data of anywhere in the state and probably in the country, because we mandated that our hospitals give us additional data to help us track this virus. The data that's really critical is how many people are going to the hospital, how many people are using ventilators, how many people are in ICU. And I can tell you that the number of people in the hospitals has been steady or declining. The number of ventilators that we have available has been steadily rising. The number of people that are coming into the hospital with COVID-19 has been steady or declining. So those are all really good signs. And that's information that we get every single day. We don't have to rely on the state. As a matter of fact, the state takes our information for some of their decisions. This will enable us to open up certain businesses at the right time with the correct health protocols. This will mean that social distancing and the use of office coverings or face coverings will not go away anytime soon. In order to continue to tamp down the curve and eventually lower the infection rate, we have to move methodically based on the best medical advice. I know that we all want to get back to work and open businesses. I certainly do. The key drivers for our local economy are airport and the seaport, and we're working with federal and state officials to see how we can start to open more flights in a way that's safe for passengers and employees. And that, as it is, the airport and seaport are crucial right now for food and medical supplies for Miami-Dade County, as well as the nation and for our entire hemisphere. It's important to keep in mind that certain businesses may not have to wait or may have to wait longer than others to open because of the nature of their business. If there's close contact between customers, that's going to be a problem. And I say this because you may have heard me repeat this over and over again. Everyone has to act as if you have the virus. In fact, our study has shown that a lot of people have this virus and don't even have any kind of no kind of symptoms. The reality is, again, that most of the people we have tested positive for the virus are not experiencing any symptoms whatsoever. It's dangerous for those folks who are at high risk, such as our seniors and people with lung disease, diabetes, compromised immune systems. That's why social distancing and using masks in interior spaces, along with constant hand washing and disinfecting high-touch areas, is so important if businesses are to open again. The county has provided test kits to the University of Miami for a random study that will check for those who have antibodies to the virus. What researchers have found so far confirms what I've been saying. Many more people have the virus than the 11,000 or so that have tested positive through our medical test sites. In fact, there are anywhere between 123,000 and 221,000 county residents who have the antibodies to the virus based on this study, and half of them told the again that they never experienced any symptoms. So we must keep that in mind as we prepare plans to eventually open businesses. I also want to reiterate that any business openings ordered for the county set a minimum standard. But again, if your business is located in a city, that municipality can decide to not open certain businesses in their city, even though similar businesses could be open in the rest of the county. Cities cannot allow business to open without the county doing so first. Let me reiterate that again. A city cannot allow a business to open without the county doing so first, but they can decide to keep them closed. So you must make sure your city officials are aware of the needs of your business and your customers. The working groups and the medical experts are going through all the steps that will be required to make businesses safe to open again. These new procedures will be very clearly explained to business owners, workers, and customers. And they will also be standardized as much as possible across industries so people can easily adapt to the new normal. It'll also be a lot like life right after 9/11. We will be making it as easy to understand as possible. We will also know that the steps we need to take to prepare our businesses to open and to prepare workers and customers to enter those facilities. And just as we are doing with outdoor spaces, enforcement will be a key to the success of the interior openings. We will take corrective action if protocols aren't strictly followed. We still have some work to do, but we're off to a very solid start with these groups. There is light at the end of the tunnel, and I'm looking forward to getting there as soon as possible with your help. We held virtual meetings with each of the interior spaces working group this weekend. We're now ironing out the details to make sure they follow the protocols recommended by our health experts and also how they align with the governor's message yesterday. With each step along the way, we rely on the input of our healthcare experts. And I want to reiterate that very much. We rely on the input of our healthcare experts, our business owners, our community partners, organizations such as the Chamber of Commerce, and all the people participating in today's interactive webinar. As always, health continues to be our top concern. Our working groups will be making rules to keep people safe both outdoor and indoors, but it's still up to everyone to take personal responsibility. As we adapt while moving to a new normal, our new motto is, I keep you safe, you keep me safe. That's the mission we're working on together.